In late January, we opened our hospital incident command system to focus our resources on what we were starting to think might be a significant system-wide emergency. 6 weeks later, we expanded the command center staff to include broad leadership from across the organization, and we started meeting every day, more than once a day. On March 10th, we sent our first of what became a daily communication update to all 7,000 employees, and 3 days later, launched an internal COVID-19 website to keep everybody up to date on what was happening. Things were moving and changing at an unbelievable pace. We secured our campus by closing some entrances and separating access points, protecting our staff and patients from the virus. And we came together as a statewide healthcare system, working with hospitals across Minnesota to share information about bed and ventilator availability so we could share resources across the state and support as many patients as possible. During this intense period, we needed to move fast to respond to the rapidly changing situation. In mid-March, we canceled all non-essential, non-emergency clinic visits. To be able to continue to care for our patients, we quickly ramped up virtual care, including telemedicine and live video visits. Our information technology department supported the technology needs of more than 1,500 employees as they transitioned to working from home, and we moved from in-person to virtual huddles and team meetings. To preserve personal protective equipment, redeploy staff to support our ICU needs, and to keep patients and staff safe, we canceled or rescheduled non-emergency procedures and surgeries in late March.
Hennepin Healthcare has played a major role for Minnesota during the COVID crisis. Our staff have been front and center on the front lines. We've had the highest volume of COVID patients of any Twin Cities hospital during the initial surge of cases. We've cared for more than 900 inpatients so far this year. We created and implemented inpatient surge plans that included opening a new intensive care unit when we were at peak capacity. Like all hospitals across the state and country, obtaining and maintaining personal protective equipment was critical, and the ingenuity of our staff led to creative solutions like the PPE buddies to help keep our frontline staff as safe as possible. Rapid, accurate testing became critical, and our labs ramped up quickly, implementing on-site testing and adding equipment to become one of the leading labs in the state, with some of the fastest test results back to the patients and staff. To serve our community, we opened a dedicated testing clinic on our downtown campus and added community testing sites in Whittier, Richfield, and Brooklyn Park, and we've tested more than 80,000 people across our community to date. Our home care nursing staff and community paramedics have provided on-site testing in congregate care facilities like shelters and long-term care facilities, and they work together with the state and Hennepin County to meet those needs. Our physicians and advanced practice providers are also researchers, and we have been a partner in research and therapeutic treatments, including convalescent plasma, losartan, remdesivir, and a national staff surveillance study.
Hennepin Healthcare is a leader in medical education. Early in this crisis, we decided that preparing tomorrow's physicians meant preparing them during a pandemic rather than separating them from the opportunity to learn. As a result, we did not pull back our resident trainees, but rather taught them how to keep themselves and their patients safe. Our role as a teaching hospital in this community is to prepare tomorrow's workforce for anything that comes their way. The next novel virus, the next global pandemic, and to be leaders along the way. While residents continued to work, medical students were temporarily pulled back by their home institutions, as these medical schools recognized that masks, gowns, and protective gear were in short supply. Clinics closed and surgeries deferred, creativity emerged as we sought to redeploy Hennepin Healthcare staff to meet emerging and unpredictable needs. Our Human Resources Department worked hard to match staff who were willing to step in to the multitude of needs across our system. The hospital experience changed for everyone, including those hospitalized patients who didn't have COVID. All hospitals across the state restricted visitors to protect both patients and staff. So we turned to technology to help. We provided iPads and other communication technology to connect patients, their care teams, and their families. Throughout this pandemic, our employees continued to deliver the best possible care and support despite a sea of challenges. This is really hard work. To better support our staff, we offered a myriad of mental health and coping resources, including an employee wellness center with food and support, a telephone warm line to connect with a mental health professional, and team support calls for psychological support. Our cafeteria created a pop-up critical supply store so employees could get necessities, such as toilet paper, fruits and vegetables, and other supplies that were in high demand in local grocery stores. And we partnered with a local hotel to offer downtown accommodations for staff who were concerned about exposing family members to infection, those needing to quarantine, and for others who simply needed a respite from a challenging workday.
COVID has the potential to be financially devastating to hospitals. When we canceled elective procedures and postponed clinic appointments, we lost critical sources of revenues. However, we maintained our workforce substantially intact. That was needed to respond to the pandemic. We purchased equipment and supplies to prepare our organization for public service. We expanded workers' compensation eligibility and paid employees who needed to quarantine at home. Then we looked inward, very deep. We moved quickly to reduce expenses by cutting the CEO and executive salaries, holding the 2020 incentive programs, slowing down hiring into open positions. And across our organization, employees took unpaid furloughs. These were extraordinary actions of good stewardship. Let me add that we have been very fortunate to receive Federal CARES Act funding, Minnesota Department of Health grants, and funding from Hennepin County. And the generosity of the community has been gratifying as donors have stepped forward to support the Hennepin Healthcare Foundation, both financially and in kind, with personal protective equipment. We have not faced the financial challenges of this pandemic alone. Most important, we've had our employees and we've had you.
Unfortunately, health disparities that have victimized communities of color for ages have now become more pronounced and more deadly during COVID-19. An example, in Minnesota, African Americans account for 6% of the state's population, but have been 19% of the confirmed cases of COVID-19. The statistics are similar for Latinx communities. Early in the crisis, we created a community messaging work group that has been routinely meeting with representatives of the communities that we are privileged to serve, with the goal of hearing what is working and, very importantly, what is not working for our communities. In response to what we've learned, we have rewritten many of our educational materials. We have created videos in the languages that our communities speak. And we have established routine check-ins with our communities, our patients and their families to better understand what are the emerging issues and trends that they are seeing. We are partnering with our communities through this pandemic together. We've conducted a basic needs survey to understand what our patients were experiencing. And as one example, when we learned that telemedicine, which is so important to getting care during the pandemic, when telemedicine services weren't working for all people, we made changes to lower the barriers to getting telemedicine and to reach out to people in different languages to start the calls and the video sessions so that people can access care. And now, after careful consideration and thorough planning, we have been able to invite people back into our facilities for their care here at Hennepin. It is safe to get your care here. Our staff is masking up. We do screening at the door. Our communities are coming into our facilities, which have been thoroughly cleaned at high-touch checkpoints. We're using appropriate social distancing. The safety of our patients, their families, our communities, and our staff are of utmost importance. We're here for life. We're here for you and with you during this pandemic, and we're here for you and with you during better times as well. We are here to join you on your journey to health and wellness.